Hello, everyone. We're just going to give it a minute so that everybody that's in the holding room can join the webinar live. Thank you all for taking the time to join us today. My name is Malia Ellis. I'm the veterinary sales manager here at Erchonia Lasers. And today we're going to have Dr. Rachel Starr, who is a small animal practitioner, going to be presenting on a lot of different feline laser applications, because a lot of times we don't get into a lot of depth with the different applications for the kitties. So we wanted to really kind of dive into several of the different treatment applications that you can see in a daily practice yourselves and take these applications away. These are Erchonia specific applications because there is a difference between Erchonia lasers and class 3 and class 4s. So if you do have any questions about that, of course, let us know. But without further ado, I'll go ahead and let you start, Dr. Starr, and then I'll pick up at the end and go through a little bit more details about the laser options we have available.
Okay, thank you, Malia. So we're going to talk about kitties today. And I think that cats present a really good treatment. Laser therapy is a very good treatment option for cats. And I'm going to start with how laser therapy works, because this is a very non-specific therapy. We can apply it in many, many different ways to the body, because this is the electron transport chain in a mitochondria. And complexes 1 and 2 absorb violet light. Complex 3 absorbs green light. And complex 4, the accepted theory is that it absorbs red light. There's a paper out there that's, when we look at the absorption spectrum, is actually violet light. And there's a paper out there that talks about red light actually working more in the interfacial water layer and at ATP synthase. So with these 3 colors, we can affect really the entire electron transport chain plus in generating more ATP. So when we generate more ATP, we end up with increased cellular function. And increased ATP production, we know, leads to increased DNA transcription. When we increase DNA transcription, we get cellular proliferation in the event where we are trying to heal a wound or really in any tissue. We get increased protein synthesis. We need to transcribe DNA to synthesize proteins in the body. We get increased enzyme production because we need to transcribe DNA to make enzymes, hormones. So basically, whatever the cell does, it needs to transcribe DNA to do it. Therefore, laser therapy helps the cell do whatever the cell does better. This gives it a broad-reaching application. It's also anti-inflammatory, helps with pain. Those, I think, are really common applications that people know about. So I'm going a little bit more in the not as common applications. So cats, absolutely, arthritis, broken bones, all of those things, laser therapy is applicable just like it would be in a dog. But I'm trying to go more cat specific today. So why are cats great candidates for laser therapy? Cats are notoriously difficult to medicate, right? How many owners say to us that they're not able to pill their cat? So we have compliance issues with owners, as it's common enough known that, there's a cartoon about it right there. We often need to consider this when we look at treatment options. So if the owner can't medicate the cat, what do? Laser therapy is an option in many different diseases. So we're going to talk about some of them. So we also regularly sedate or medicate cats for exams or handling, right? Most technicians, if you talk to them, they would rather take an 80-pound pit bull with a muzzle on than they would a 10-pound cat with fangs and claws. So we often sedate cats in order to be able to handle them. And they have several medical conditions without good treatment options, where we don't have particularly good treatment options for their medical conditions. So cats are a unique treatment challenge because, I need to go backwards. Hold on. Let's see. Oh, there we go. Okay. So this is my kitty on catnip. And, you know, they are personalities. Cats are, they can be unique treatment challenge in many different ways because they are themselves, right? They do their own thing and they're not people pleasers the way that dogs are. Ah, sorry, I'm getting there. Huh, I can't hit the play button. Okay. It's in the way.
You can't get the slides to change, Dr. Starr. You can just keep it
No,
in this window.
okay, I can keep it in this window.
Yeah.
Well, I can't hit the play button because it's under the one that says I'm sharing my screen, and I would have to stop sharing my screen to get to the play button.
Yeah, just to keep it in this window. That'll be
All
fine.
right. Okay, we'll do that. So calming. We can use laser therapy for calming. And we know that kitties in the vet clinic like sometimes medications to do that for them. Lots of kitties coming on gabapentin. But we can actually use the lasers to increase parasympathetic tone. And we know that when we laser, we get a release of nitric oxide. I'm going to go over some research on that here in a minute. Animals often relax during laser therapy. So I have animals that come in who are pretty excited, and as we laser them, they calm down. And your owners will remark on that like fairly often. They're like, oh, they're starting to calm down, and they do. So in order to do this, you can do what's called a sympathetic overstimulation protocol. This ramps up the sympathetics until they reset to a normal tone. And the frequencies for that are 216, 36, 61, and 16. I do this for 180 seconds or 3 minutes over the sympathetic nerve roots. So this picture here to the left, we're doing a sympathetic stim in this kitty. It's hard to see the violet light, but we are using a red violet light to do that, laser to do that. And then we do this because this kitty is a striker. We're unable to handle her. We're really even unable to get the lasers down too close into the carrier with her in the beginning. So we would laser her with a sympathetic overstim protocol, and then we'd come back and laser her. I'm going to go over her here in a minute. She's an asthma kitty. And then we were lasering her lungs. She also has some eosinophilic granulomas that we were lasering on her lips. So in order to get those lasers down close to her, we started with the sympathetic overstim. You can also do a parasympathetic stim, and the frequency for that is 240. We sometimes lasered cats when we needed to do like blood draws and things like that. If you laser them with a sympathetic stim, leave them in a carrier for about 15 minutes, maybe even 10, and come back to them after that. Okay, so I'm going to talk a little bit about violet laser because this is one of the reasons I use the violet and red in a sympathetic overstim or in a calming type where I'm looking for sympathetic parasympathetic balance, is because this first paper here at the top talks about wavelength and irradiance dependent changes for intracellular nitric oxide level. 405 nanometer was found to release the most nitric oxide of any other wavelength. And when we release nitric oxide, we are causing a parasympathetic response. We're going to get vasodilation. This is the 405 nanometer wavelength of light is good for that when it comes to calming. It's also directly antimicrobial. I've presented lots of papers on that in the past. I'm not putting, I have a couple of them in here. We'll talk about that in a minute. It helps to modulate immune response. This paper to the right, the second one down, talks about the 405 nanometer wavelength of light in nitric oxide, releasing nitric oxide, and the effect that has of protecting cells against COVID-19. It helps to increase the immune response, and especially when paired with green. There's quite a few studies out there where they pair green and blue together, or green and violet. When it says blue, like this paper does, that is actually 405 nanometer wavelength of light. It's sometimes referred to as violet and sometimes referred to as blue in the literature. And then again, on the bottom, the violet blue, that's a 405 nanometer. This was a study done on releasing cytokines, and at low dosage, we got it inhibits cytokine release. When we get into too high of dosage, because it's very high energy wavelength of light, we don't want high dosage here. The energy comes from the wavelength of light, not power. And so it's good at inhibiting cytokines, but it can trigger cytokines if we put too high of a dose in. So we need to be a little bit more careful with the 405 nanometer wavelength of light. So feline applications for violet laser. Again, cats are notoriously difficult to medicate. So we might be able to decrease antibiotic use. I use this as an adjunct therapy for chronic upper respiratory infections and feline asthma. So this is that cat from the beginning to the right here, who we were lasering for feline asthma, and she got less drainage. She was breathing better. She eats better. She does everything if we laser her every couple of weeks. But also from the standpoint of just feeling better, this is her after 8 to 10 laser therapy treatments. So we couldn't touch her before we started lasering her.
I know, I heard that.
And now she's purring and rubbing on us. And I saw her yesterday. I think we still laser her, or Monday. I saw her Monday, and she was rubbing and purring on us then too. You can see she's got a little bit of redness left there for eosinophilic granuloma on her lip too. So when I am lasering, I use my infection protocol is 784, 20, 363, and 42. With infection, I go for longer periods of time, especially bacterial infection. I go for about 10 minutes over whatever area the infection is present in. And then when you're talking about asthma or upper respiratory infection, I would also use the inflammatory protocol. That is 9, 16, 42, and 53. What I use for asthma is 21, 20, 42, and 363. And then if you are just lung in general, anything you're going to laser in the lung frequency is 21. Okay, so here's a couple of papers about antiviral effects. And specifically, when I'm talking about upper respiratory infections, these are in people because we don't have a lot of studies done in animals, but it is effective. I put 2 articles here where using the 405 nanometer wavelength of light was effective in neutralizing herpes simplex virus 1 in people, or in it kills that virus. So, and I have had luck in treating upper respiratory infections in cats with it. So I think it probably also kills herpes virus, but I couldn't find anything research-wise where it's been used specifically against cat herpes virus. And then I had somebody asked about FIP, and I couldn't find anything specific to FIP with 405 nanometer, but there are many, many studies out there on coronavirus. FIP is a coronavirus, and on COVID-19. So it is definitely effective against COVID-19. It does kill COVID-19, which is another coronavirus. So has the potential. I do have one patient that I've lasered with FIP. He is responding very well. He's pretty much normal at this point, but he also is being treated with antivirals. So it was used as an adjunct therapy to him, not as the only therapy. Okay, so this is just a couple of articles on the antibacterial effects of the 405 nanometer wavelength of light. So we have MRSA, it's very effective against MRSA. Low doses are effective. We do not get increased benefit with higher doses. This concluded that this one on the bottom concluded that violet light therapy was an effective tool in fighting antibiotic resistance against beta-lactam E. coli, this most sensitive, but MRSA, Pseudomonas aeruginosa, and staph pneumoniae were also included. So for our cystitis UTI kitties, we don't have a particularly good treatment for cystitis. We can do antibiotics when it comes to urinary tract infections. So this is my bladder protocol, 43, 53, 42, 24 for 3 to 5 minutes. Violet and green wavelengths help to modulate the immune system. The violet light is antibacterial if infection is present. So if you do have bacteria, it would be helpful. And then we decrease bladder inflammation with the inflammation protocol. And they feel better very quickly. They stop peeing all over the place. So chronic kidney disease, again, we don't have particularly good treatment for chronic kidney disease. We try to prevent it from progressing more than anything else. So kidney protocol is 43, 53, 42, and 20. We can decrease kidney inflammation with the inflammation protocol as well, especially in an acute injury to the kidneys. So there's lots of research out there on renal injury in rats that we can look to for low-level laser therapy. So all of these studies showed that laser was protective in induced renal disease in cats. So we have multiple studies out there that show from reperfusion injury to diabetic kidneys to all different kinds of things. And then was renal protective in diabetic rats that were induced diabetics. And then the one on the bottom here, they looked at 635, 532, and 405 nanometer, which is red, green, and violet all together in renal fibrosis. And they found that green and violet, if you've heard me talk about green, is really, really good for stem cell activation, that they saw improvement in that kidney function through stem cell activation. So using the green light, green, and then the violet for all the reasons that I just talked about, violet, and then red on top of that for inflammation. All three of those together had the best renal outcomes. This is a paper that was put out in 2022 on the therapeutic potential of photobiomodulation for chronic kidney disease, where they talk about we don't have particularly good treatments for kidney disease, death, transplantation, or dialysis, and that we need new ways of treating it. So photobiomodulation effectively mitigates mitochondrial dysfunction, reactive oxidative stress, inflammation, and gut microbiota dysbiosis, all of which are inherent in chronic kidney disease. So we have research that shows that it helps with all of these things that are associated with chronic kidney disease. And then the paper is about recommending using laser therapy in chronic kidney disease. So inflammatory bowel disease in cats. Again, cats notoriously difficult to medicate, especially IBD cats, because they are miserable and cranky and they are never happy. So many are not eating. So adding supplements, probiotics, enzymes, or medications to food. They quit eating. They don't eat anyway. So it's hard to get them to eat. So the GI frequencies are 83, 96, 20, and 363. This is what I use in my inflammatory bowel disease kitties. I also use 10 because that's the vagal frequency and the communication system between gut and brain. She presented to me with a diagnosis of inflammatory bowel disease. She had chronic diarrhea. Sometimes her feces was malodorous. The owner said not always. All fecal output was diarrhea. Sometimes there was some semi-formed material on top. She was hiding and she was not eating well and didn't ever want to interact with her owners. So, and that was in July of this year. So, a month later, Nina had done 4 laser treatments once a week. At this point, she had mostly soft stools. She had 4 normal stools since the last laser treatment a week before. She was eating well, and the owner said that she was confident, affectionate, out in the open more, and laying in laps. So we continued to laser Nina once a week for a little while. Then we went to every 2 weeks. And then I was able to, before I wasn't able to get any supplements into her. Like we tried putting probiotics into her food. We had tried putting enzymes into her food. We had tried lots of different things, but she wouldn't eat. And she really wouldn't eat if we put anything into her food. So over time, and any protein that we started, she might do better on for a while, but then she would redevelop diarrhea. So after we had lasered her for about 2 or 3 months, we were able to switch a protein to one she hadn't been on before and get solid stools. I added some fiber and she was still eating well, and we were able to get fiber into her. And I saw her yesterday, and we're currently lasering every 2 weeks. She's had all form stools. She's eating well. Again, the owner reports that she's confident, affectionate, playful, and now interacts with the dog in the house, even which she really would never interact with the dog. So just some research to back up using laser or photobiomodulation, low-level laser therapy. It's all different kinds of things in the literature that it's called for inflammatory bowel disease. There are some, this is a clinical review at the top was done where they found it to be helpful in inflammatory bowel disease. And then this is repercussion of inflammatory bowel disease and lung homeostasis. So this article is looking at the relationship between the bowel and lung inflammation. And they found that when they lasered the bowel, they had increased lung parameters. So they showed that biomodulation treatment reduced biomarkers of inflammatory bowel disease and reverted all augmented parameters in the lung, restoring it to homeostasis. Thus, we confirm experimentally the important gut-lung axis and the role of photobiomodulation as a promising therapy. So in this one, they treated the gut, and that impacted the lungs as well. Okay, so this one is effects of photobiomodulation in colitis, and there's multiple articles. When we induce colitis in animals, we can help to reduce that inflammation and bring them back to solid stools faster when we use low-level laser therapy or photobiomodulation. Okay. So if anybody has questions about kitties, I have to show this video because it's so cute. This is my dog and my cat together. They love each other. He's a weird cat, I know. But if anybody has any questions,
it looks like we have 2 in the Q&A box if you want to read them out loud, because I don't think anybody else can see those.
Okay.
And then
so the first one is in the Q&A box, and it says, if a cat has several issues to be treated, example, hip or chronic kidney, is there a suggested maximum treatment time per laser session? So I usually don't run a total of more than 15 minutes. I do, however, stack lasers. So I have, oh boy, how many do I have now?
9.
Yeah, I think so. So I have 9. 9 So I have Yeah, 9. I have 9 lasers. So I will stack lasers and do multiple laser treatments all at the same time. But I usually don't go beyond 15 minutes for total treatment time. But I would treat both hips and kidneys at the same time with different lasers. So you can do that and input energy into the body. You are not going to hurt anything though with these lasers. You can go, you can leave them on there for really, really long time and you're not, the power is so low that the body has the ability to dissipate the energy. You're just not going to get increased response probably after about 15 minutes. Though there are people on the human side of things that that will run lasers for 30 minutes or longer. So okay, have I used okay, the question is, have you used photobiomodulation and dilated cardiomyopathy or AFib cases, cat or dog? Also, have you used on spleen immunological response? Okay, yes, I have used, I've used the lasers in dilated cardiomyopathy. I have not for AFib, but I definitely see dogs with dilated cardiomyopathy improve symptomatically, that like coughing goes down. They tend to be able to have more energy and they're able to perform better. So I have definitely lasered hearts. I don't know that it reverses dilated cardiomyopathy, but again, more ATP output, you're going to be able to have better response, better energy. And spleen, have I used it on spleen? Yes, I do use it on the spleen. I use it in autoimmune cases. I have presented those in other lectures. So yes, I use it. Can you use it in the spleen? Yes, especially if you're looking at a bacterial case or a virus and the spleen being an immune organ, it could be helpful with clearing those types of things. Okay, how about cancer patients? I've used laser for immune stim and pain in these patients, but should be concerned about stimulating cancer growth since laser can increase cellular proliferation. So I use these lasers. I want to be really specific. I use these lasers in cancer patients and have even presented cancer patients in lectures. I would not use infrared light for cancer patients. When we look at the research behind that in vitro, there's a difference between in vivo and in vitro. When we get into the higher wavelengths of light, even at 670 nanometers, which is red light, we see increased proliferation of cancer cells in vitro. In vivo, though, is a different, and there aren't studies done in vivo, except for way back when, some of the original studies done, they implanted squamous cell carcinoma cells in the cheek pockets of hamsters, and then they lasered those with red light. And about 30% of them fell off after they had established cancer cells in those cheek pockets. Then they lasered them, and about 30% of them fell off. So it can be helpful in cancer, actually, because, again, we're going back to especially green, violet paired together do increase immune response. And cancer is a failure of the immune system. Just to clarify, which lasers do I use for dilated cardiomyopathy? I use all 3 colors for dilated cardiomyopathy because, remember, we also have that potential to stimulate stem cells. In dilated cardiomyopathy, we have a potential maybe to regenerate some of those heart cells if we can get stem cells into the heart and get them to differentiate. So green is good for that. But otherwise, if you don't have green as an option, I would use red violet. Again, with the violet, we're getting into being able to stimulate more of that electron transport chain and generate more ATP. Okay.
I think that we got all the questions.
Okay.
Thank you so much.
In the chat?
In the chat, I think
Okay.
we're good. Everything
Okay.
should be good to go.
All right.
But thank you everybody for joining us today. Thank you, Dr. Starr.